Welcome to the latest episode of Techlandia, Tao's regular podcast series. I'm Skip Newberry, President and CEO of Tao. And with us, we have as our guest, Dr. Khalid Alston, who's a doctor of naturopathic medicine and also a tech company founder. Dr. Alston, welcome.
Thank you so much for having me. I'm excited to be here.
Excellent. So, as our listeners know, I like to start off with a little bit of background info, our featured guest. And I'm intrigued, what caused you to pursue a career in healthcare and kind of take us through your journey?
Yeah, so it's funny. When I went to college, I actually went as a BA in psychology because I got a scholarship for science and math, but I chose the least scientific, least mathematic of my options because my mother told me I had to get the scholarship. And so I was like, okay, let me do psychology. And my mother, as after I graduated, I learned that my mother, she had breast cancer. And that is what put me on the path towards wanting to learn about medicine. The conventional medical system had actually failed her, and so she started to do a lot of natural things, and I was her primary caretaker, and that experience opened up my eyes to the power of alternative medicine and/or the power of alternate routes to achieving a goal, and that's what inspired me to look into and study naturopathic medicine. I had to go back and complete my post-bac and do all the science classes that I intentionally avoided as a naive college student. And then I moved from New York City to Portland, Oregon to study naturopathic medicine. And somehow I now am building a tech company.
That's awesome. Yeah. So, what would you say is the most rewarding aspect of your day to day in medical practice?
It's you learn and hear about so many people's stories, and you really start to understand what people are actually going through in the real world, and I I'm actually in the middle of my workday right now because I work full time as a doctor while building doctor notes. And I just had a call with one of my favorite patients. I don't have favorite patients, but one of my favorite patients. And
They're all your favorite, right?
they're all my favorite. But this woman, she's amazing. I do medically supervised weight loss, and she's down about 170 pounds right now.
Wow.
And yeah, we started working together about 2.5 years ago. And you know, on the outside, if somebody looks at her today and is like, "Oh, you're down 270 pounds, you're doing this, you're doing that," and like, it's so easy to celebrate somebody's story. But the hard part and the part that is often ignored and missed when you look through the nuance is like what somebody actually went through and all of the struggles that is actually the real human experience. And as a physician is incredibly humbling because I I know those stories, and people often tell me things that they don't even tell their partners, you know?
Yep. Yep. Yeah, that element of trust, there aren't too many professions out there that's like a core piece every day.
Yeah.
Um, yeah. Yeah, and I'm wondering, like, what was the aha moment that led you to create Doctor Notes?
Yeah, so I have been using AI in my medical practice for about 3 years now, relatively early adopter, and there are these things that are very popular now, but they're called AI scribes. And with an AI scribe, I'm able to walk into a visit, I'm able to press record on my phone, and then the AI system on the back end writes my entire clinical note. It pretty much does all of my administrative tasks. And now, if you go to the doctor, you'll notice that your provider probably is asking you for permission to record your appointment because that is what they're using. Large hospital systems are now doing this. And as I was using this, like, it transformed my workflow and just my stress in my job, and I was like, "This would be an incredibly amazing tool if patients could have the same exact thing, but the output was and the outcome was shifted to the left slightly to be optimized for patient understanding and caregiver workflows, right? Everything in medicine is built for provider and billing and hospital system workflows. But what if we took this technology and built something from the ground up that was designed for the patient and the human workflow? Something that I wish that I had when my mother was sick and when I was her primary caregiver as a 22-year-old. And so I was like, let me build this. And being the naive, ADHD riddled person that I am, I was like, cool, I am going to knock this out in 3 to 6 months max. It's funny. I was looking at it the other day. I put up a landing page and I was going to ask for like some friends and family to like, crowd fund the project. And in there, I had a guarantee. I was like, if I'm not done with this project in 3 to 6 months, everybody can have their money back. And then yeah, it's the naivety is amazing, but I spoke to my brother, he was like, "No, this is a great idea, don't ask anybody for permission." Here I am about 18 months later, way beyond 3 to 6 months, but that was the genesis, and that's what kind of put me on this path and on this mission.
It's funny talking to a lot of founders over the years. That's a common issue. It's like, oh yeah, this is going to take X amount of time, and it never does. It
Yeah.
always takes longer. Yeah, but still, at the same time, it's nice to have that drive, that sense of urgency that's kind of compelling you along. And why not set a goal that's a little bit ambitious? And like
Yeah.
you said, you like if you're able to kind of get even part of the way there in that time frame, your chances are your investors or other supporters are going to stick by you because they want to see you succeed. So, tell me, like what what would you attribute to like the early success of the company to? Like, walk us through how you actually got from prototype into like, okay, the testing portion and kind of that early feedback from users. What did that look like?
Yeah. I've been incredibly blessed to have amazing people and amazing support around me from day one. As a non-tech founder, building a tech product, I stepped into a world where I had no expertise whatsoever. And we live in a time where there's amazing information around you. And so, like, all of the various audiobooks and podcasts and all of those resources were incredibly helpful. But there were a pair of patients of mine, right? A husband and wife combo. One was a high level product manager at Nike, the other one was a high level tech data manager at a health tech company, right? Husband and wife. And they came on early as advisors and helpers. Like, I told them about the idea during a presentation. They're like, "Oh, I would love to help you with this." And they thought that they were gonna just kinda step in and just, like, give me advice once or twice, and then they ended up just being like, holding my hand through a lot of things.
Mhm.
And they were the ones who taught me what UI and UX really meant. The husband, he worked a lot with offshore development teams, and so he was on the calls with me with my development team in Pakistan, and he helped me to understand what a scope of work actually is and how you communicate your vision and your goals to an engineering team to actually get that done. They helped me understand what regression testing is and all of these things that I had no idea what they actually were and would not have been able to learn from a book. And it is they are hands down the reason why our product is actually something that is functional, that works well, that looks very nice and does its job, is because I've had those people. And the same thing has been happening just like naturally as time goes on. It's, the Oregon tech scene and just the culture of Oregon as it's like a communal supportive place. I stepped in and like have been working with OEN, with TAO, with the Oregon AI Accelerator, with the Innovation Hub, with OHSU's Bioscience Readiness Program. There's all of these different tools and people around that have just been able to step in at just like the right time and help to buoy me and like give us and our team just like the resources, education, and support that are needed.
That's fantastic. I mean, that's one thing that I like to tell people is kind of our secret sauce, as it were, here in Oregon, is just the amount of resources, given the size of the community, that you do a startup here and you can get access to a lot of incredible people, great networks, and you can be a bigger fish in a smaller pond. It's not a terrible thing.
It's it really isn't, and, like, Oregon's not a bad pond because you've got, like, fresh fish and you've got blueberries and raspberries even coming up, like, you could do a lot worse, and I'm so excited to be able to build this in Oregon and, like, blossom from Oregon, you know?
That's awesome. That's so great. I was wondering if you could take a couple minutes just to kind of walk us through some of the features. Like when you're typically approaching someone, who's going to be using this, what would you say among the features really kind of stands out? Is there one or more aspects to it that are kind of the initial hook for folks?
Yeah, we have we we've been fortunate to it's been by consequence and also by design to keep what our core product is just very simple. And so the way it works is we have an app that is on Apple and on Android, and you put it on your phone, and then you're able to walk into any medical environment, had any medically related conversation, you record that conversation on your phone. And then within a few seconds after that conversation is done, what you will see appear on your phone is a very well constructed, organized summary that is written in about a seventh grade level, but still retains all of the medical complexity and nuances of that conversation that you had with your provider. And then you're able to take that conversation and that summary and translate it from English to Spanish and Spanish to English, and we're adding more languages soon. And you're also able to take that organized, constructed summary and share it with friends and family who are supporting your care journey. And in doing those few things, we're able to solve a lot of the genuine pain points that people have, which is one, all of the stuff that you forget when you leave your medical visit. And then two, how do you involve the people who are genuinely trying to help you when there are all of these safeguards and roadblocks built into the medical system that prevents your family and friends from knowing what's going on so they can support you and you don't feel alone and feel isolated in this like overwhelming system.
That's really great. I mean, there's obviously a lot of jokes out there about like doctors and bedside manner and communication issues and all that stuff. But there's a certain element of truth to the complexity that exists within healthcare, and how do you meet patients kind of where they are in such limited time frames too? Because oftentimes, like, you don't always have a ton of time with your healthcare professional. And I'm wondering, from a communication standpoint, what are some of the things that, if you had a magic wand and could say, if we could solve this aspect of kind of doctor patient interactions beyond what you've already done with doctor notes, like, are there other aspects that you would tackle next?
So many,
You're like, how much time do we have?
so many. And, and I don't think that I think there's a lot of things in life that are not easy, but they're simple,
Mhm.
and I think that's to answer your question, the way you solve the healthcare crisis and or the frustration that a lot of doctors have is not easy because it's a very complex system with so many interests involved, but it's simple. And it comes down to removing the or limiting the profit model that forces providers to see patients every 7 to 15 minutes, and providers don't like it, patients don't understand it, and so there is a rightfully so, but patients feel a lot of frustration, and a lot of that frustration gets put onto doctors, and they make it feels as though like the doctors don't care or don't remember or don't put in the time to give individualized care. But the reality is, and this is something that, you know, I learned as I actually started practicing medicine in the real world, is that like doctors are seeing anywhere from 20, if you're lucky, to 50 patients a day, and a doctor is working anywhere from 3 to 5 days a week. If you're working 4 days a week, you're seeing 40 patients a day. That's over 120 patients a week. You
Mhm.
know, per month, you're looking at 500 patients per month, and you're forced because of the way the insurance reimbursement model works to see people back to back to back to back, which just makes it really hard for a provider to give the level of individualized, personalized care that they genuinely want to do, and if we could change that structure that requires providers to do that, because again, it's not their choice, then you would see patient outcomes come out so much higher, and that system is kind of what unfortunately makes it required or the word I'm trying to say is necessitates. There we go. Necessitates
Mhm.
a product like this because as patients now in the medical system, and I tell people this all the time, like you have to be your own advocate more than any time before. And even with my own patients, like I'm in their corner 1010%, but I don't have the time to do as much as I want to and as much as I know they deserve. And you have to be able to step in and advocate for yourself and be empowered, which is why it's so cool that all of these new AI tools are available, which are on one end scary to providers, but it also is really, really potentially empowering for patients.
Yep. Yeah. I mean, I think about my wife and I are both attorneys, and she, still is actively practicing. But for me, early on, I saw that it was a similar kind of profit motive associated with time and
Mm,
billables.
mm,
And until that system changes, we're not going to be able to improve kind of the quality of interactions that we have unless we get more efficient and free up our time for what matters.
mm.
To your point, right? And you do it through technology. That's really the only way that you can, apart from the system as a whole changing, you free up time through technology. And what's kind of ironic to me is that SaaS tools often ended up creating they promised more free time, but they ended up essentially requiring more work and more output. And I'm wondering if you see something similar with AI, or is AI different because of the fact that it's so easily focused around things like human language and communication and having those types of interactions. Do you see a similar trend here where as AI continues to get traction, where because the system isn't changing, it's going to still require us to see even more people in shorter time frames?
I
How do
think
we
it
get out of that?
I think it depends on the lens with which you're looking at things,
Mhm.
right? Because there's the promise of AI that because it's such a powerful tool that it gives us our time back. But then when we're a few years out of like mass adoption, you look at people like you and me and people who are building things who are actually doing so much more and cognitively carrying so many more tasks, which is freeing and empowering, but is also overwhelming because now I can step in and I can do marketing, I can do engineering, I can do this, I can do that, and like it's a lot of code switching for our brain because we now can do so much more with such a condensed time because you can have agents going and working on 17 things at one time for you. So like
Yep.
on that side, no, or you have to be very careful about how you are utilizing or thinking about the technology. But then also you can step back and remember that most people in the world are not using AI like that,
Right.
right? And so that's where you think about, like, what does a quote unquote AI product look like for the consumer, right? What does an AI product look like for your 60 or 70-year-old grandmother, who is reticent, who has technology reticence and is not going to be using agentic workflows? And how can we take this technology and make life easier for them, right? Um,
Yep.
and then there's the provider workflow, which is a completely different conversation. And like I have visions and goals of like stepping in and streamlining the prior authorization process and kind of putting that power in the patient's hands. And these are things that are like down the line that I have visions for. And so it's a long roundabout way of answering your question, which is like yes, no, maybe so, depends on who it's for and what it's doing and how those guardrails are set up. I don't know if that answers
Yep.
your question at all.
Yes. That's almost like a very lawyerly response too. Like, well, it depends. um,
My wife
but
loves that I answer things like that. Oh, man.
no, that was great. And the other thing that really strikes me in talking to you is just how much sort of empathy and understanding you have of your patient's sort of context, right? I mean, and this is something that you never would have been able to create kind of what you did with doctor notes if you didn't have that to begin with. And I'm
Mhm.
wondering, do you see an opportunity for more training in medical school for doctors as they're kind of putting the finishing touches on the beginnings of their career, where that type of human interaction is going to be increasingly what defines a good or great doctor from one that's mediocre?
Yeah, so much so. I mean, it's hilarious as a naturopathic doctor because it's hilarious and it's incredibly validating because in Oregon, people know what naturopathic medicine is. Outside of
Right.
Oregon, most people are not familiar with it. And so just a little bit of context. As a naturopathic doctor, our entire philosophy comes down to trying to figure out what the underlying cause of disease is, right? In school is a 4-year medical degree. We study nutrition, we study herbs, we study nutraceuticals, aka supplements and nutrients, exercise, lifestyle. So we do all of that and we do pharmacology, right? And so like in Oregon, I'm licensed to give. I like to tell people I can give people opiates, I can give people hypertension medication, I can give people lemon balm herbs, right?
Yep.
And in our school, there's so much focus on the human in front of us, and to a def- to a so much so that it errs on the side of too much. So, like, a lot of times when you go to, like, naturopathic school, you see an ND, your visit will be, like, 60 to 90 minutes long, which is far too long,
Yep.
right? And it's interesting because technology and scientific studies are catching up with a lot of the things that I won't even give it credit to naturopathic medicine, but a lot of, like, ancient, traditional, medical theories where you talk about, as you said, like the human connection, the effects of stress, the impacts on caregivers. We're actually starting to be able to see and like quantify in medical studies that like, oh, like this is actually real. Stress does kill because cortisol does spike things, right? And there are studies that are coming out that talks about like how important the quote unquote human connection is for medical outcomes, right? And that translates things into a very Western conventional language that then gives us the permission structure to then incorporate these things into like I won't even say conventional, but just into standard education and medical education. When like so much of this stuff feels like it should just be logical, like yes, logically, let's emphasize and make it important to like sit down and talk to a person and like validate their feelings and empathize with them. We shouldn't need a triple control, double blind, placebo, 10,000 person study to let us know that it is worthwhile to like validate a person and sit down with them for more than 15 minutes because that will increase patient outcomes. It's like duh, mother effer. But but yes, it is becoming increasingly important, and it's gonna become so much more important as you start seeing these companies starting to streamline the process and using agentic AI, like nurses and triage practices that remove humans more and more and more from the medical process. But, like, the human is the healing part of medicine. The one last thing I'll say on this about just the human healing part of medicine is another incredibly humbling thing about practicing medicine and, like, really doing it is I'm always amazed by how often somebody gets better and how validated people feel when you don't even do any quote unquote medicine, natural or conventional, and you just like sit down and listen to them and let them tell their story and let them air their grievances, things just start to heal and like fix themselves on their own, right? And the more we remove the human aspect from that, the more we're going to lose that. And that's something that we really need to find ways of protecting in medicine.
Yep. Yep. So you've got a lot going on. Like what do you do in your spare time? Like specifically, like what do you listen to or read that you found particularly, helpful or inspiring?
In my spare time, every once in a while, I'll like every 2 or 3 months, I'll go see a movie or
Mhm.
go see an action thing for fun. I saw Demon Slayers at the Arlene Schnitzer, like, in
Oh
concert.
yeah. Yeah, yeah.
It was so awesome. Like, I've been seeing these orchestras play, like, movies. It's, like, really, really cool. But free time is all doctor notes all day, every day. My wife loves that as well.
I'll bet.
But audiobooks, podcasts, I've recently pivoted to listening to a lot of autobiographies
Mhm.
because I've found myself in a stage where listening to people's stories, listening to how different people were able to grind through the hard times is kind of what I'm in need of right now. Interestingly, 50 Cent has an autobiography, which is really insightful. It was actually really good. It was really surprised me. I
Huh.
right? You should check it out.
I will.
It is genuinely surprising. I don't wanna say how smart the man is, because like, anybody who's that successful and who's been around for that long is clearly a smart individual, but, like, it's
Right.
genuinely like, surprising how well constructed and how insightful the book was. The guy who founded Xerox, I just went through his autobiography. No, not Xerox, Kinko's.
Oh
Kinko.
yeah. Yep.
Yeah, the Patagonia one is amazing, so a lot of those. Circling back to some podcasts, there's so many. I love Libby. I've recently kind of started to use the library app, which has
Yep.
saved me money from my Audible subscription. Yeah.
I love those recommendations. That's awesome. A separate conversation at some point, but yeah, I have a 6 degrees of 50 cent story from my grad
Right.
school days.
I'd love to hear it. I wanna pick you
Yeah.
'cause, you're a lawyer by trade, my father's a lawyer by trade, but you guys are my father's in the funeral business, you are in the tech business, so I'd love to, like,
Nice.
that how that transition happened.
Cool. Well, I look forward, yeah, to continuing our conversation too, apart from the podcast. But yeah, no, I wanted to say thanks for taking some time to spend with us today. I know you're busy and really appreciate it. Lots of insight shared today, and frankly, your story and what you're working on is really inspiring. So thanks again.
I really appreciate the time, and TAO is an amazing organization. You guys have the awards coming up, and it's a huge honor to be nominated for that category in your award. So I'm just really excited to partner with you guys and build together.
Cool. That sounds great. Well, thanks again, and it was a pleasure.
Thank you so much.
Thanks for tuning in to Techlandia. If you enjoyed today's conversation, be sure to subscribe, share it with your network, and leave us a review. It really helps grow the show. Techlandia is about connecting you to the people, ideas, and innovation shaping our region's tech community. If you want to support the podcast and its mission, check out the links in the show notes. Until next time, stay curious, stay connected, and keep building what's next.